The moment I realized that I wanted to move forward with bariatric surgery is when my father was diagnosed with diabetes. Both my parents are now diagnosed with diabetes. My mother has type 1 and my father has type 2 diabetes. I decided to have bariatric surgery for myself, and it wasn't because I had any ailments, high blood pressure or anything. It was mainly because I wanted to avoid my future 20 years from now. Everything that I'm doing right now is preventative.
There are some metabolic conditions that are so intimately tied into weight, into obesity, that the weight loss and the surgery really affect those. And an even better scenario is that we've done the operation, we've got people through the program before they've developed those problems, before they've developed the diabetes, before they've developed the hypertension. That way it's preventative as opposed to treating something that's already going on.
I think Steve kind of represents a lot of our patients. He's a guy who's trying to pull things together from a health perspective. People talk about their weight management or weight loss journey. We talk a lot more about lifestyle. Lifestyle's hopefully for a long, long time. So initially when patients see the behaviorist, they're coming in part for an evaluation to see if the surgery is appropriate for them, but really to talk about preparing for this lifestyle change. And I think a lot of the best work I do comes after surgery, when we're talking about how do you maintain these changes.
The surgery changes your body metabolically. So to be predisposed to diabetes and heart disease, to know that you've changed your body and gotten into a place where you are not going to be as predisposed to those diseases that come from being a larger person, and really having my parents be that kick in the butt that I need with their health situations. I didn't want that for my children. So my son lights up my world. He's so proud of me, and so when I get home and he sees me coming from the gym or coming from a workout, he always compliments me. He has seen the change in me, and I try to encourage him to come out with me on a walk. I do try to cook in front of him so he can understand those things. Just really trying to encourage him through my journey to pick up better eating habits, better exercise habits, things like that.
The surgery in some cases is the easy part. Living with the surgery can be really trying for some folks, and that's why you have a full team. You have a dietitian, you have a psychologist, you have the surgeon, the medical assistant.
What do you do for exercise?
The team is phenomenal. They're welcoming, they are very encouraging, they are there to support you, and you just feel like it's a place where you want to, that you feel safe to share your story and to share your journey.
These kind of operations.
What we try to do is keep things as easy as we can for patients, to try to keep things in one place, but it really takes that effort on their part so that they have the nutrition both before and after, that they have the psychological assistance before and after. And the biggest difference between bariatric surgery and a lot of the other surgeries that I do is that it is not a one-stop shop, and we expect that lifetime follow-up.
I feel fantastic. I've been able to do things that I haven't been able to do in quite some time. To get out of surgery, to get back home the next day, to go for my first walk, and to be here a few months down the line and running 1.5 miles to 2 miles, it means a lot. And I know that I can achieve anything. I reclaim the healthier me by taking ownership of my life and doing something about it.